Thanks for joining us again. Today we're going to talk about a device called the Urolift, which looks like this, and we'll discuss how insertion of small staples into the prostate cavity can significantly improve waterworks symptoms for men in a short period of time with minimal side effects. The device itself looks like this, and we'll talk in more detail about the actual staple itself, how it works, who it works for, and I will show you some of the evidence, so please stay tuned. This cartoon shows the prostate on the left before and then after insertion of 4 Urolift staples, and you'll see there's obstruction of the flow of the bladder by the 2 lobes of the prostate, and then afterwards, when the staples have been deployed, there is a better opening within the prostatic urethra, which is the water pipe as it runs through the urethra. So this is the Urolift device, and you can see here the actual size of the prosthesis that is inserted into the prostate. So we'll move straight into some animation just demonstrating the procedure itself. This is the view that we get up the male urethra as we look with the cystoscope, and you'll see here that the lobes of the prostate are obstructing the flow to the bladder. Under direct vision with a telescope, we look into the prostate cavity and insert the device. One lobe of the prostate is then compressed, and the device is fired, which allows automatic deployment of the staple, which stabilizes itself on the inside and outside of the prostate and holds the prostate lobe open. We'll then repeat this on the other side, so exactly the same procedure. The prostate is compressed and the staple is fired, and then this automatically positions itself in the prostate so that the prostate is held open. Now, the number of staples used will depend on the size and length of the prostate. You'll see here the idea beforehand with obstruction to the flow of the bladder, and afterwards after insertion of 4 staples. And this is the view that we get down the cystoscope before and after the procedure. So this is a close-up of the staple itself. There's the urethral or the water pipe end piece, and then there's a capsular tab which sits on the outside of the prostate capsule, and there's a self-tensioning suture between the two which holds the prostate apart. So who is this device for? Well, it's for men with BPH. BPH is benign enlargement of the prostate, which is very common in men. The prostate sits around the base of the bladder, around the water pipe, and it gets bigger as we get older and can cause compression of the urethra and can cause symptoms. It's very common, and we'll see that in men over the age of 50, there's about a 40% prevalence. Over the age of 60, this goes up to 70%. 80% of men over 70, and nearly all men over 80 will have evidence of BPH. Now let's talk about the sorts of results that we get from this intervention for male lower urinary tract symptoms. There are always drawbacks and benefits for any treatment, and that is medical with drugs or that's surgical with an intervention. You'll see in this graph there are benefits in yellow and there are drawbacks in red for different interventions that we have. And one of the interesting things about Urolift is it doesn't seem to have those sexual side effects which can bother men so much. So that's erectile dysfunction and retrograde ejaculation. And this is one of the things that Urolift just does not seem to do. Its benefit is not quite as marked as perhaps laser treatment or TURP, but there's still a very significant improvement in symptom score, as you can see. So if you're suffering from side effects, or if you're already treated with medication and the side effects are problematic for you, please don't hesitate to get in touch with us. We would be delighted to talk to you further about this and other options for benign enlargement of the prostate causing symptoms in men. This is the 3 of us, Dan Spurnat on the left, Mark Lloyd in the middle, and myself, obviously. Please, as I say, don't hesitate to get in touch. We'd be delighted to see you at any time. If this video has been helpful, please subscribe. Please hit the like button. We'll make more videos, which hopefully will help you understand some of the things that we do within urology. And as I say, please do not hesitate to get in touch with us for a discussion at any time.